Hello everybody, today we're going to talk a little bit about toe pain. Alright, so I get a lot of runners and a lot of triathletes that come in and they complain of pain in the top of their toe. And oftentimes, yes, there's a million different reasons, but I feel like as therapists and as patients and as athletes, we miss some really obvious things. In your toe, you have a muscle called your extensor hallucis longus. And if your extensor hallucis longus, which actually makes your toe go up like this, imagine that's your toe and it goes up, well, that's what your extensor hallucis longus does. It extends your toe. However, if you don't have that motion and you're toeing off and you don't have good extension of your toe, you can get pain up in here. Often also, you can, come on. Also, okay. Hello everybody. Today we're going to talk about toe pain, all right? And I get a lot of triathletes, a lot of gymnasts, and a lot of runners that come in with toe pain right up in here. And there could be a million different reasons for it. It could be capsulitis, it could be turf toe, it could be a million different reasons. But there also could be one reason that is often overlooked, which is you could have strained your muscle called your extensor hallucis longus. Your extensor hallucis longus is made to extend like your toe. Extend your toe like so, like that, okay? And that muscle lies actually in between your anterior tibialis muscle, which is what it does is it inverts and dorsiflexes your ankle like so. And then it gets sandwiched in between your extensor digitorum longus, which helps you evert and dorsiflex like this. Now, if you actually hold your foot like so and find your tibia, so your tibia is this really long shin bone, come off of it laterally. And what you're going to do is you're going to dorsiflex like so, and then invert like so. And you're going to feel that muscle pop into your fingers. Now you're going to go more laterally, okay, where your fibula is. And what you're going to do is you're going to dorsiflex and evert. And you're going to feel another muscle pop into your fingers. Now the muscle right in between that, it gets sandwiched, is your extensor hallucis longus. So if you just bring your toe up, and then go into that crevice, you're going to feel the extensor hallucis longus. Now, if it is indeed your extensor hallucis longus that's giving you trigger point pain into your big toe, which is the top of your toe, what you can do is smash into that region. And how I would actually smash into that region is I would get a ball or even place my fingers right in between the two and extend, or I would flex and then extend like so. Flex and extend like so. I'm just trying to lengthen the tissue there. All right, if you guys have any more questions, you guys can contact me on Twitter at Dr. Blake Wu, on Instagram at Dr. Blake Wu. You can always hashtag Ask Dr. Wu, or you can always find me at the Sports Pod. And it's all going to be displayed right here. All right, I'll see you guys later.